Hey everyone, thanks for tuning in to this segment of Chamber Chat. I'm Lauren Grimmick, the Executive Director of the Melrose Chamber of Commerce, and on this episode, I'm really excited to introduce to you the newish sort of CEO of Melrose Wakefield Hospital, Sue Sandberg. Hi, Sue.
Hi, it's nice to be here this evening.
It is so great to have you here. You've been out and about in the community doing a lot of things. And I know you've been meeting so many Melrosians and so many people in Wakefield and the surrounding towns, but why don't you just tell us a little bit about yourself and your background?
Sure. I like to start with that I'm a nurse. I think that's very important.
That's super important.
Especially in leading a healthcare
Absolutely.
organization. So I began my career as a nurse.
Yep.
This is actually really the third major area of the country I've lived in as a nurse. I've spent most of my career in the north, but what has always been a constant is that I work for community health systems.
Okay.
I have a passion for healthcare close to home, close to family, in a community. And so I'm real excited to be here in Boston area for the first time. Love this town of Melrose and really enjoy working for Melrose Wakefield Healthcare.
So where are some of the other places you've been? You said you're not from the Northeast.
No, I like to say I'm a prairie girl.
Okay.
I grew up in Minnesota.
Yep.
And spent 15 years in Chicago.
Yep.
And when we started to raise our kids, we raised them in Indianapolis.
Okay.
Tried to move to Raleigh for a couple years and
Yep.
learned that we are not Southerners. It gets very hot in the summer down there.
Yep, it does.
And so are excited to be back in the north again.
Good, good. Well, we've got some winters coming up, but sounds like you'll be well prepared for New England winters.
Yes, there was a lot of taunting of that when I was here for my first New England winter last year, but very mild still compared to where I grew up in Minnesota.
Right, absolutely. Well, certainly it wasn't the New England winters that kind of attracted you here.
No.
So sort of what was it that brought you to Melrose Wakefield Hospital or attracted you to it?
Yeah, that's a great question. And there's something really unique going on here in Massachusetts. Working in other areas of the country, people look to Massachusetts because Massachusetts is known for having exceedingly high quality
We're very
healthcare.
lucky, very
yes,
lucky.
and you can't lose with all the wonderful hospitals and academic centers here training doctors and nurses. But it's also known for being a very high-cost area of the country for healthcare. And there is a push here in Massachusetts. A lot of care gets done in Boston, where the big academic medical centers are. So what intrigued me about this job is this job was set up to try to do something different than the way healthcare is in a lot of big cities.
Right.
And it was to start pulling healthcare out of the city back into the community.
Sure.
And I think I told you that's my passion.
Yeah, yeah.
So to be able to do healthcare close to home, I think when someone has a healthcare illness, to be close to friends and family.
Sure.
It is so important. The stories I could tell you as a nurse, seeing what a difference that makes to a patient's recovery and ultimate wellness.
Sure. To have those folks, their network closer.
Yes. And I like to say where I grew up in Minnesota, it was an hour and a half to a large healthcare system. We had to drive to Sioux Falls, South Dakota, 90 miles.
Oh my gosh.
And it's not that different here.
Right,
Look how close we are to Boston and how much time it takes in traffic to get into a big city.
That's what I was thinking. Proximity-wise, people might say, Melrose, 12, 15 miles from the city, but with our traffic and with all the industries we have, in Boston, it's tricky to get in and out.
Yeah, and we shouldn't have to spend our whole day in traffic. I did that enough when I lived in Chicago for 15 years. And so to be able to bring healthcare back, so what we're doing, the system Melrose Wakefield belongs to is called WellForce.
Yes.
And
tell us a little bit about that.
Yeah, and that's kind of what drew me into this. It's Tufts Medical Center for the academic medical center, the Melrose Wakefield here in the near north suburbs, and then Circle Health up farther north, up in Lowell.
Sure.
And the whole goal is to how do we bring care back to the community close to home. It's also cheaper than the most expensive care in the country is what's done in an academic medical center.
Right.
For real reasons. We support medical education and research. But a lot of what occurs in a hospital does not need to occur in an academic center. So we do not need to overpay for care.
Right.
I like to remind people that as a nurse and a CEO of a hospital, I still have to buy health care. I
Right.
don't get it for free.
Right, right.
The nurses and the doctors in healthcare don't, and it needs to be affordable to us too.
Right.
Healthcare is expensive.
Right.
And so the more we can take it closer to home, where we can offer the same quality at a lower cost, exceedingly important to all of us as consumers.
Sure. Oh, that's great. And it's clear that it's passionate to you, and you've probably, been in these various hospitals, so you've kind of gotten to know, where you want to be at this point in your career.
Absolutely.
And I mean, certainly Melrose Wakefield Hospital has a lot going on. I know that there's was a new maternity ward, so there's lots of things with surgical services. So why don't you tell us a little bit about some of the things that are happening at the hospital?
Sure. So the new maternity ward has just recently opened, and it is beautiful. It's been completely redone, very spa-like, very relaxing. It was designed with input from childbearing women.
That's great.
And it's gorgeous, and we're getting great reviews on it.
Good.
As far as other things, what's really unique is we're bringing physicians from Tufts Medical Center out here.
Okay.
Again, avoiding people having to
go
drive into the city.
Yep.
I like to say it also avoids parking. We do free parking at Melrose Wakefield, which seems like a small thing when I've spent most of my career in the Midwest. But here we know you park in Boston.
Metro Boston, parking is a very hot topic.
It's more
even
expensive.
in Melrose.
Yeah, but parking costs more than what you pay the doctor on the copay.
Right, right.
And so for the physicians to come out here and care for patients and to be part of our team, it's really important. I remind people all the time, the doctors who like to practice in the community and try to provide care close to home have gone to the same medical schools as the doctors who choose to practice in academic medicine.
Right.
So there isn't a difference there in the quality of a physician or the nurse, and that's a key difference.
Sure, yeah.
So we have some of the Tufts surgeons who work downtown, such as the spine program. They do neurospine surgery at Tufts and at Melrose Wakefield. We actually, it's not known to a lot of people, we really have the most comprehensive general surgery program here in Melrose. Go figure.
Did not realize that.
Yeah, the assortment of surgeons that work with us, we do more robotic surgeries than anyone here in the north suburbs. I think we're doing the only robotic surgeries in the north suburbs. Real important if we're trying to make healthcare affordable, because you can get in and get back to work sooner when we do things robotically versus open incisions. We also have a strong bariatric program. We have, we're bringing more and more higher level surgeries back to Melrose, which were done years, like a decade ago here, and should be done here. There's colorectal surgery. We have phenomenal breast surgeons. And we've got the general surgeons that take care of simple things like hernias. And so quite an array of really, really talented specialists right here in Melrose.
And so to your point, like where before people might have to, see a doctor locally and then get sent off into the big city, if you will, or somewhere else, they're able to kind of do that comfortably within their community.
Yes, and people don't know. I was talking to a woman, I was speaking at the Lions Club this week, and one woman told me, I thought I had to go into a big name hospital. I didn't know. And she said, can you link me up with the doctor, which I was delighted to do. But, she brought up the reality. She said, I had to take off work to go, and it took me a long time to get there and come back. And then I had to go back 2 days later to repeat a lab test. And so I love that the convenience of what we can offer. Again, same tests, same caliber physicians right here in Melrose.
Same quality of care that you can do it right here, close to home, close to work.
Exactly. In the system, I think we're doing it right. We have obviously a substantial amount of physicians and services right here in Melrose. But we also have outpatient facilities in Stoneham. We have them in Wakefield. We are reinvigorating Medford in what used to be Lawrence Memorial. We do have some inpatient beds there right now for Jerry Psych, but we are nearing work with the city of Medford and the community around that hospital to bring in the first licensed, off-license, I should say, surgery center in the state of Massachusetts with the hospital. So we're real excited to be leading the way on things.
That's great.
That's going to be an exciting thing for this area and especially for Medford.
Sure, right. I mean, and all of these communities are close and certainly closer than Boston, you know, for whatever people will need.
Right.
So they can get there.
Saugus, Malden.
Yeah.
I mean, we're everywhere in these near north suburbs.
Do you think that, is this, since I'm not in the industry, is this, you know, a trend, or are we lucky that we in Melrose kind of have this sort of the community-based care and sort of the model now that the hospital has adopted with telling people they don't have to, or is it lucky based on
you know,
where we're
it's
at?
different than what's happening nationwide.
Right.
And again,
Okay.
that's why I was
question.
excited.
Yeah.
What you're seeing a lot of nationwide is care being pulled into the big city.
Okay.
And that
So it's the
doing
reverse.
this,
Yeah.
and it's the right thing for patients. As a
Right.
nurse, I'm always going to be passionate, again, besides community, doing what's right for the
Of course.
patients.
Right.
So it's fun. It's fun to come in, and it's fun to build what we're building.
Right.
Orthopedics is another huge program that we are really getting very, very strong at right now with the caliber of the orthopedic surgeons on the team there.
That's great. So it's sort of slowly building up all of these things and kind of really taking the care of the community as a whole.
Right, right. And it's a lot more complex than people know. It's having the right equipment, the right support staff. But when we talk orthopedic surgery,
Right.
the orthopedic surgeon is who most people look at when they say, you know, who did your hip, who did your knee, who fixed the torn ACL.
Right.
But as a nurse working in it, I'm also concerned about who's doing anesthesia.
Of course.
Because the pain management and the way we do the blocks is really important. And again, that's something we have excellent coverage on, which really, again, helps with that recovery.
Right. No, that's great. It's important. There's certainly a lot of moving pieces within all of these things that you're doing a great job managing. I mean, communication is certainly important then, to be out there communicating things and communicating all these things that the hospital is doing. What are some ways, you know, website? I mean, you've got a blog, right? I mean, what are some ways you guys are communicating all of this?
Yeah, you know, we're trying lots of things. I think the way we communicate today is very different than when I started in healthcare 30 years ago. You'd run ads in the paper and put up a billboard, and those aren't effective today. Society today is very computer centric, and so a lot more we're doing. Like when you bring up the web, yes, we have a Facebook page, we have an Instagram account, we tweet, we have a very robust website, and a lot of our marketing is done in those channels these days too, as is a lot of the marketing in America. So yeah, I started a blog, and I did that for many reasons. I wanted to connect closer with the staff too. And so I've been out and about. I've published 2 right now. I've got more coming out, but just trying to talk on my reflections on being a new member of this community and a new member of the team at Melrose Wakefield.
It's a nice way for staff to just get a little bit more about you and kind of see who you are.
Absolutely. It's fun. I was writing on the cardiac team the last time I blogged, because we just put in a brand new state-of-the-art cath lab. We have 2 cath labs at Melrose Wakefield. And the team is excited about that. So when I say to them, okay, let's talk a little bit more, because I'm going to blog about you. The next day, it's, when's your blog getting published? When do we get to read?
And they look forward to it.
Yeah, it is. And they do such wonderful things. It's fun to be able to highlight them, because the rest of the team members read it too. And healthcare is within a hospital, everything is so specialized. A nurse working in the ER may not know what they do in the life of a cath lab, or a nurse working in critical care or med-surg. We're all very compartmentalized and very specialized when we deliver the whole package.
Oh, that's good. It's one more awesome thing that you're bringing certainly to Melrose and to the hospital. And I thank you for being on the show. We could talk so much about it. I've learned so much more about you, which has been really a treat for me. I wish we had some more time. But if you haven't gone to Melrose Wakefield Hospital recently, hopefully that's a good thing, because you haven't needed to. But when you do, you'll probably be surprised at some of the changes that they've made there. But hopefully you'll get to see and meet Sue Sandberg when she's out and about in the community. Thank you so much for watching this episode of Chamber Chat. I'm Lauren Grimmick.